penile implant isn't for everyone. We typically reserve this surgery for men that have failed oral medicines like Viagra, Cialis, Levitra, Stendra, Staxin, or men with a bend in their penis that also happen to have erectile dysfunction. One of the best things about the penile implant is that it's covered by almost all insurances. This includes Medicare. There are two basic types of penile implants. You have your malleable rods, which are bendable implants with no actual mechanism to them. There's no inflation, there's no deflation mechanism to it. And then you have your inflatable device. These are the ones that you can pump up, keep up as long as you want, and then bring down, giving you full control of your erections. Both the malleable and the inflatable implant are great implants. Think of the malleable as the Toyota of penile implants. It's dependable, it's reliable, it works. It's an implant that's inserted, and the best thing about it is it's always up and it's always ready to go. Of course, the worst thing about it is it's always up and it's always ready to go. On the flip side, you have your inflatable implant. This is more like the Lexus of penile implants. It has more gadgets to it. It has more of a mechanism to it. You can inflate it, you can deflate it, you can keep it up for as long as you want, you can bring it down whenever you want. And this one really gives you the most control of your erections. The inflatable penile implant has 4 pieces to it. There are 2 cylinders that go inside the penis. There is a storage pouch called a reservoir that goes in this natural space in your pelvis called the spacer retius. And then there's a button or a pump that hides inside your scrotum. All of this is internal, you can't see any of it. And whenever you want to give yourself an erection, you simply squeeze that pump in the scrotum, inflate the device. You can keep it up for as long as you want, you can have sex for as long as you want, and you can bring it down whenever you want. The release button to bring it down is also attached to that pump. You simply squeeze that button, you give the penis a little squeeze, and your erection will come down. One of the best things about the penile implant is that it really doesn't affect your ejaculation or your orgasms or sensation. All it really does is give you a great erection that you have full control over. Your ejaculation, your orgasm, the sensation, and your ability to have all of that stays exactly the same as it was before surgery. Now, if you've had a prior prostate surgery and you're unable to ejaculate, that doesn't change. But the penile implant surgery itself does not impact these 2 things. The penile implant itself is made out of a material called Bioflex. It's safe, does not degrade inside your body, and inside of this Bioflex material, we put saline solution or just salt water. It's safe. If for some reason there's a break in the implant or the water leaks out or the fluid leaks out, it's non-harmful. This surgery can be done in the hospital or in the surgery center. It's extremely safe. When you come in, you get IV antibiotics. We take you back to the operating room. We give you general anesthesia. After you get general anesthesia, you're going to get a local block. And what this will do is reduce your recovery pain. We then do a special wash and a special prep. And we do take all of these measures to reduce the infection risk to under 1%. We then make a small incision, about 2 to 3 centimeters in size. This is typically down in the scrotum. We then put in all the pieces of the penile implant. We make a small tunnel where the cylinders will go. We put the reservoir down in the pelvis, and we put a pump or the button that you squeeze in order to get an erection down in the scrotum. I take I'm extremely efficient. I do the surgery in about 30 minutes. But I take the time that's needed to make sure you have the best sized implant for you. I know size matters, and so I take the care to give you the longest and strongest implant that you can accommodate. It's an extremely quick recovery. Most people in the nation will tell you it is 6 to 8 weeks. Our recovery is about 3 to 4 weeks before you're ready to use it. And that's because we make a very small incision, only about 2 to 3 centimeters. We take the extra care where it's needed. We make sure that you're counseled on icing and using a tight scrotal support. We give you a block which decreases pain and that encourages healing. And we get you up and moving as quickly as possible. I typically expect this implant to last about 10 to 15 years. The data shows about 88% of penile implants are still going strong at 10 years. But sometimes they break down sooner. They may break down at 1 year, at 5 years, at 10 years, 15 years, or 20 years. If it breaks down sooner, then we just simply take it out, wash everything out, and swap it out for a new one. One of the best things about the penile implant is the satisfaction rate. The satisfaction rate for meds and really for any other treatment is about 50% or less. And the success rates for many of these are about that amount. For the penile implant, the success rates are close to 100% once you've healed. And the satisfaction rates are right around there. They're about 94% for patients and even higher than that for partners. The penile implant has the typical risks that you see with any surgery that you have done. Risks of infection, risks of bleeding, risks of anesthesia. You have to be able to wake up from the anesthesia, and that's why we have a cardiologist evaluate you and make sure that your heart is strong enough to undergo it. And risks specific to the penile implant include a 1 to 3% risk of infection, the risk that the prosthetic can find its way outside the body. We call that an erosion. It's rare, but it can happen. And of course, a risk that surrounding organs like the tube that you pee out of called the urethra or the testicles that are nearby can get injured. I'll tell you that overall, it's a very, very safe surgery. These things are very rare. About 97 to 99% of patients have no issues whatsoever. And my expectation is that you'll be one of those patients.